Drugs acting on the endocrine system. So first, let's talk about the thyroid hormone. So you have your T3 and T4 as well as calcitonin. So these hormones are produced by your thyroid gland. So T3 is basically the active form of thyroid hormone, while T4 is the inactive form. So basically your body converts T4 into T3 so that it can be used by the body. Anyhow, so what's the role of the thyroid hormone? So basically your T3 and T4 are for protein, carbohydrate, and fat metabolism. So when you're thinking about thyroid hormones, you have to think about metabolism, right? And so knowing that, remember that your thyroid hormones have an effect on your heart. So it affects the heart rate and the contractility of the heart. So T3 and T4 have chronotropic and inotropic cardiac effects. They also help with RBC production as well as a regulation of a person's respiratory rate and drive. On the other hand, calcitonin is another hormone that has quite a separate role in our body. So calcitonin, which is produced by the thyroid gland, is used to increase bone formation, and it decreases reabsorption of calcium in the blood. So basically, again, it brings calcium back to the bone to help with bone formation, thus decreasing the serum calcium level or the calcium level in the bloodstream. Hypothyroidism. Hypothyroidism is a condition wherein a person has low levels of thyroid hormone. So this can be primary, secondary, and tertiary. Primary is the most common type. So when we say primary, the problem is mainly from the thyroid itself. Secondary and tertiary is caused by something else. Anyhow, so in primary hypothyroidism, you will notice that the thyroid hormones change specifically. So you have to remember this. So in primary hypothyroidism, your TSH or thyroid stimulating hormone is going to be high, and then your T3 and T4 are going to be low. On the other hand, your in secondary and tertiary hypothyroidism, the TSH and the T3 and T4 are low. So all of them are low. So again, you have to remember this, right? So TSH, thyroid stimulating hormone, is a hormone that is actually produced by the pituitary gland. And so when it senses that the body has low thyroid levels, it will basically produce more of this TSH that actually tells the thyroid hormone to produce, the thyroid gland to produce more thyroid hormones. Common causes of hypothyroidism: Hashimoto's thyroiditis, which is basically an autoimmune disorder of the thyroid that causes inflammation of the thyroid. Certain drugs such as amiodarone, also pituitary dysfunction and iodine deficiency can cause hypothyroidism. Another cause of hypothyroidism is thyroidectomy, or basically the removal of thyroid glands. So it can be a partial or total thyroidectomy, but basically whenever you have reduced size of the thyroid gland, it may actually cause a decrease in production of thyroid hormones. And of course, if you don't have a thyroid gland at all, right, which is responsible for producing thyroid hormone, then your thyroid hormone levels will go down. So basically your T3 and T4 will go down. Signs and symptoms of hypothyroidism, or cues for hypothyroidism, right? So think about it. Thyroid hormones are for metabolism. So if you don't have enough, right, what happened with your metabolism? Think about slowing down, right? Because you don't have the fuel, right, for metabolism. So think about slower metabolism. So what you're going to see in a patient is weight gain, cold intolerance, dry skin, fatigue, and weakness. In order to treat low thyroid levels or hypothyroidism, we administer thyroid elevating agents, or basically we administer thyroid hormones. So mainly it does the job for a patient's thyroid hormone, whether they're not producing enough or they don't produce any thyroid hormone at all. So the therapeutic effects that we should expect when we're administering thyroid hormones is that of the thyroid hormone. So again, it helps with metabolism, growth, and so on. Indications for it would be hypothyroidism or hypoactivity of the thyroid gland. Precautions and contraindications. So of course we don't need, or we're not supposed to administer it if a patient is allergic to it, if they had a recent MI, because that can add stress to the heart, as well as adrenal insufficiency and hyperthyroidism. Side effects that we need to assess for include rash, urticaria, nausea, tachycardia, dysrhythmias, weight loss, and fever. So rash and urticaria are basically itching. Rash, kind of like hives, and itching. Example of drugs that you have to know. So there are different types of thyroid hormones, but the most commonly prescribed is levothyroxine that can be under the brand name Synthroid. So again, remember the generic name, not the brand name. Now let's talk about hyperthyroidism. So it's basically the opposite. So this is a condition wherein the body produces more thyroid hormones that we need. So this is the excessive level of thyroid hormones. So typically what you're going to see in hyperthyroidism is a decrease in TSH, which is your thyroid stimulating hormone, and increase in T3 and T4. Now a common cause of hyperthyroidism is Graves' disease and as well as thyroiditis. Signs and symptoms of hyperthyroidism is going to be the opposite of hypothyroidism. So in here, right, your metabolism is too fast, and so you're going to notice a patient's having weight loss, heat intolerance, tachycardia, and exophthalmos. So exophthalmos is basically a condition, an eye condition wherein the eyes get enlarged and they're going to look like they're going to pop out of basically the eye sockets. So this is typical symptom of hyperthyroidism. Knowing that a patient has hyperthyroidism, then we have to administer something that should lower the thyroid hormones. So a treatment for it would be your thiamides or thioamides. The mechanism of action of these drugs include inhibition of the synthesis of thyroid hormones, or basically decrease, right, of production of thyroid hormones, and it does not affect the existing hormones. So it just basically prevents like production of more, but if they already have a lot, right, the body has just to wait until that level goes down on its own, because it doesn't damage or basically eliminate what's already present in the patient's body. Now, the therapeutic effect, of course, would be to decrease the thyroid hormone levels in the patient's body, and then indication is hyperactivity of the thyroid gland causing hyperthyroidism or high levels of thyroid hormones. Precautions and contraindications or reasons why we shouldn't give this drug include if a patient is on amiodarone, digoxin, and oral anticoagulants. So amiodarone and digoxin are antiarrhythmic agents, and so knowing, right, that how the thyroid hormone works, it affects the contractility of the heart as well as the heart rate itself. And so if you already know that a patient has a heart condition that affects their rhythm, they're on this medication, right, it's counterproductive to give them thyroid medication that will lower the thyroid hormone levels, because again, it can cause some interaction. It may actually cause a severe decrease in heart rate for that patient, and that can be very dangerous. And in addition to that, it can also interact with oral anticoagulant, affecting the effectiveness of the drugs. Side effects that we have to be worried about and we have to assess for include agranulocytosis. So agranulocytosis is basically when the granulocytes, a certain type of WBC, basically goes down. So that can be life-threatening. And so knowing that, right, so it affects your white blood cells, the patient can be at risk for getting infections. And in addition to the white blood cells, occasionally it can also decrease all numbers in your blood count. So it can include WBC, RBC, and platelet levels. So that's called pancytopenia. So that is the decreased levels of basically all types of blood cells. And another side effect that can happen to your patient would be hepatitis. The drug that you have to remember for this specific class is propylthiouracil. Propylthiouracil, or PTU, is used to treat hyperthyroidism.